our workplaces are not perfect, and pandemic has also added a lot of external factors to how we go about our lives and the stresses of the lives. There are employees who are caregivers to their children, to their parents. These externalities of the life has added the work pressure and the stress that we deal with. What can workplaces do better to create more psychological safe practices, or could create support structures to help in people's mental health journeys as well?
Right. Yeah, this is a very complicated question to answer, especially for somebody who's not a mental health professional. I can speak from my own experience. I think there are a couple of very sort of foundational things I think that an organization should remember. First is that they should not second guess what their employees need. So if somebody has disclosed that they're going through some kind of strain or a mental health condition, that they're seeking treatment for a mental health condition, ask them what it is that they might need. I think problems begin to arise when organizations assume that every person with depression has the same needs. Or every person with anxiety has the same needs. And this is why, this is another sort of a segue into a slightly different topic, but I think it's worth mentioning that very often, in conversational parlance, we will say, to normalize mental health conversations with the right intent, we will say, oh, mental health is just like diabetes. If you can talk about diabetes, why can't you talk about mental health? And that's a really tricky comparison or tricky analogy, because two people with diabetes will require exactly the same treatment regime, maybe a little different depending on their biochemistry, etc. But the drugs are more or less the same depending on their sugar levels, etc. If a person has broken their arm, it goes into a cast. It's not that complicated. But with mental health, you cannot assume that two people with the same condition will require the same support. So ask them, especially if they have disclosed to you. You have no reason to not talk to them and find out what works for them, what doesn't work for them. And I think in a vast majority of cases of work-related stress, just listen. Just active listening. Which is all about withdrawing, suspending judgment. Just sitting in front of the person and validating whatever it is that they're feeling. Not trying to trivialize it, not trying to compare it with what you might have gone through in your own life. You might be a boss who's lived a vastly different life. You might have ideas of sort of like how a person should toughen up, be a man. Don't bring all of that into the conversation, right? You might have gone through loss and suffering in your own life. Please do not compare that with another person's suffering. So I like to say that we are not in the suffering Olympics. You don't have to tell a person how big or how little, how trivial their suffering is by saying there is so much pain in the world and look, people are dying in a different country, people don't have enough to eat. All of that this person is already aware of. It doesn't help them to be reminded. They only feel that their pain is trivial, and that's just gaslighting. So just active listening, mirroring, these are some techniques. When a person tells you, hey, I'm feeling really low today because I failed an exam that I was studying for the past 6 months. You don't immediately have to jump in and start giving advice. Oh, don't worry, why don't you, have you tried XYZ coaching class? Don't get into advice giving mode. Just listen and say, hey, so what I'm hearing from you is that it's really tough because you worked so hard for the past 6 months and it's not worked out for you. This must be really tough, I can imagine. That's all that is needed in most cases. And I'm giving you an example, a real example from techniques that suicide prevention helplines use. Active listening is a magical tool. It's a powerful tool that can be used by anybody, even not trained in mental health. You don't have to be a counselor or psychologist. You can learn this active listening, and you can use it to diffuse, and prevent a situation from turning out into a, blowing up into a massive crisis. These are very handy de-escalation techniques.
And is this something which the organizations should teach to their managers of?
Absolutely. I think
practice active listening?
Absolutely. It is, you have to invest in continuous training. Mental health is, unfortunately, it is treated like, while mental health is everybody's business, we all should understand what mental health is and how it works. It does require specialist training. You have to learn the language of active listening. You have to practice non-judgmental listening. And often we come from a place of good intention. When a friend or a peer comes to us and starts unburdening, we immediately want to give them advice. But they're not looking for advice. They're just looking for acknowledgement, affirmation. So training is absolutely a must.
Any examples of a company which has really empowered their managers or created an active listening exemplars?
Yeah, absolutely. It is actually a fairly old company, and we all know this company. It's Wipro. They have been running this program called Wipro Mitra. Mitra is in friend. They started doing this at the turn of the millennium, much before mental health was a fad, much before everybody got excited about mental health. And this is an incredible program that I urge everybody to go and read up on, where what they've done is they have basically created this sort of cadre of active listeners in their workforce. They've trained them in the basics of counseling and peer support. The people who apply to become counselors, peer counselors, they go through a very rigorous hiring, almost a recruitment process.
Okay.
This is a voluntary job, so you don't get paid extra or anything to do this, but it's such a popular program within Wipro. So they're trained to take calls from employees in distress. Confidentiality is absolutely built into this. None of these counselors are asked to share the content of the calls that they receive.
Are they called counselors?
They are called peer supporters, essentially. Okay. They're called peer supporters, mitra, friend. So these are not mental health professionals. These are employees.
These are just active listeners.
These are just active listeners, essentially. So they're trained to sort of just listen, and they've dealt with like severe crises. People could have called them when they're going through suicidal ideation, and just by practicing active listening. And the beauty of the Wipro Mitra program, which it's amazing that they thought of this so long ago. They do not measure the impact of this program based on how it has influenced their productivity, or has the bottom line benefited from this. What they do measure is, hey, how effective is this intervention in preventing a crisis from becoming a major disorder such that a person has to go and seek help, maybe from a doctor. Are we able to reach out to different demographics within our employee base, or are the calls coming predominantly from the same kind of people? And everything is anonymized, confidentiality is guaranteed. So you have a beautiful system where, and imagine what this does, not just to the person who is receiving help, but to the person who is giving help. It is, I've read accounts, first-person accounts. There was one of the earlier members of the earlier batches of this program wrote a post on LinkedIn about their experience. They're no longer in Wipro, and they were reminiscing about this, and they said it was by far one of the most fulfilling experiences of my life. I never imagined that I'm capable of doing this. I'm not a therapist, and yet the impact that I got to make on people's lives is phenomenal. So here's a great example. There are other examples of companies coming up with sort of very tailored interventions for individual employees who are going through a tough time. For instance, during the pandemic, I was talking to a friend of mine who works in sort of a small to mid-sized company, and they said, one of my team members came to me and said, my job is becoming very difficult for me to do because it's very triggering. they had to talk to a lot of vulnerable people as part of their job role. So can I switch to a different role? I don't want to go off of work, because work helps me survive the sort of the chaos. So the company was very nimble on their feet. They were able to accommodate them in a different role. And after a while, when they were ready to come back to their old role, it was very seamless. Another great example I remember, again from a legacy company. This is ACC Cement. I remember I was on a panel with one of their senior leaders, and they gave us, and very matter of factly, they didn't make a big deal about, we have a well-being practice, none of that.
Yeah, so one, you're saying active listening. Second, you're talking about flexibility
in job roles.
In job roles, especially for areas where your roles could be more prone to burnout.
Yes.